People often ask, how much oxygen should I give my patient while they are under a general anaesthetic? And obviously this answer is going to vary depending on the patient and the surgery and the problems they have. But as a general rule, you should run them on the lowest possible oxygen concentration, just enough to maintain their oxygen saturations, and I'll explain why. So here are your two ridiculously oversimplified options. In situation one, you've got your patient asleep, having their operation, connected to the ventilator, it's giving them 100% oxygen, pure oxygen to breathe, and their saturations are clocking along at 100%. In option two, the patient is asleep on the table, you are giving them 30% oxygen. Remember that room air is 21%, so you're giving them just a bit more than room air. Their saturations are sitting at 94%. Now this is a better scenario to have, because if there is a problem such as a pneumothorax or major bleeding or an airway problem such as a kinking or obstruction, maybe they've got some secretions in the tube, maybe there's a kinking of the tube because the surgeon's lent on it, maybe there's a disconnection. If this happens and you are giving them 30% oxygen, you're going to know about it fairly quickly because they are going to start to desaturate. Their saturations will drop because they're no longer getting enough oxygen, which means you can intervene very quickly because they are likely to desaturate within 1 to 2 minutes of the problem happening, and you can start fixing it. While you are fixing it, as part of your airway management, you can put the oxygen up to 100%. If you have to, you can take them off the ventilator and manually ventilate them. If you need to take the tube out because there's a problem, you can put a supraglottic airway in, or you can face mask ventilate them with 100% oxygen, and their saturation should come up, and then you can really sort the problem out. But the point is, you know about it nice and early. In this scenario, if there's a problem such as bleeding or an airway problem or a pneumothorax or a disconnection, the patient's lungs are absolutely chock full of pure oxygen. So the problem will happen, and then maybe 5 to 10 minutes later, their saturations will start to drop. So you won't get any warning from the saturations until 5 to 10 minutes after the problem has happened. So you've just lost 5 to 10 minutes of fixing time. Once their saturations start to drop, you are already giving them 100% oxygen, so you've got nowhere to go. And so this is going to be much more difficult to manage because you have got to the point where not even 100% oxygen is enough to keep their sats up. And so this is a much more stressful scenario. So you want to run them on low oxygen because then you know about the problem early, if there is one, and you have a lot more room to maneuver in terms of giving them extra oxygen as they need it. Other arguably even more important thing is oxygen is toxic. If you give 100% oxygen for more than a couple of hours, you're actively going to do damage to the patient's lungs, whereas below 50%, you can give that to them for pretty much as long as you want and you won't do any damage. So this is why we run them on as low oxygen as possible to give you more time to respond to emergencies and to reduce oxygen toxicity. The final thing I'll say is, why don't we run them on room air? Well, once you've anaesthetized someone, laying them flat on their back, what happens is the back of the lungs, if this is the side profile of their lung, what you find is as they relax, the weight of their chest wall pushes down and then the table's pushing up like that. And you end up getting collapse or atelectasis in the bottom of the lung. So their lungs aren't as efficient as normal. So often, patients having general anesthesia need a little bit extra. And usually 30 to 40% is absolutely fine. Obviously, that's going to depend on the patient, depends on what their pathology is and what their lungs are like normally. But you want to give them as little oxygen as possible to give you time to respond and room to maneuver if there is a problem.